Hey guys, it's Maura. In today's video, I want to tell you guys, talk to you a little bit about the communication technique known as Aidet. Now, it's really popular among hospitals and patient interaction. The whole idea of it is to make a patient feel more comfortable so they know what's going on, and also to increase patient satisfaction. And so their whole process of them being at the hospital, or even if it's just like an outpatient kind of thing, is more enjoyable. So Aidet is an acronym, and it stands for, I have it written down up here, acknowledge, introduce, duration, explanation, and thank you. So when you first come in contact with the patient, you obviously want to acknowledge them. You don't want to ignore them. You don't want to act like they're not there. And you want to introduce yourself. So you would say, like, if you know the person's name, usually you have their information in front of you. But you want to acknowledge, hello, Mr. Smith, and then introduce yourself. My name is Maura, and I'm a medical laboratory scientist, or whatever your name is, whatever your title is. So they might be a little more familiar with your title. In our case, usually not, but you're a nurse, or you're a CNA, or you're the doctor, whatever your title may be. So they kind of will understand what type of care you're going to provide. Or if you're I'm your phlebotomist, I'm going to be drawing your blood. That way they know what you're there for, and they're like, who is this person, why are they in my space, sort of thing. Next one is duration. So everyone is usually on a busy schedule. They like to know how long things are going to take. You may just have a rough time frame, because in our case, when we draw blood, or a phlebotomist draws blood, we don't always know how long it's going to take. But if we have an outpatient, we may have to take their paperwork, and we may have to enter it in the computer and look up the orders that their doctor put in. And so we'll just say, oh, it'll be a few minutes, we're going to put your orders in the computer. And that lets them know, again, kind of what your job is, what you're doing. And then you may also want to let them know if there's somebody in front of them. So the duration obviously is going to be a little bit longer if they have like 5 people in front of them that need to get their blood drawn first. So some people may, if they're not supposed to be fasting, they'll be like, okay, I'm going to head over to the cafeteria real quick and I'll be right back. Or maybe they'll go out to their car or something, or they may get a magazine because they know it's going to be a while. Next one is explanation, and that's when you're going to explain what you're going to do. So once you're in the patient's room, or like I said earlier, in the case of a phlebotomist, if it is an outpatient, you're going to say, I'm going to draw your blood. They may have questions about what kind of tests they're going to have done. Some people don't ask, some people don't. Some people already know, some people don't know, don't care, just whatever their doctor ordered. But some people may have questions. And that's when a lot of times a phlebotomist will come back maybe to one of the medical laboratory scientists, like me, for example, and ask them, hey, can you explain to this patient what this test is? A lot of times they kind of know, what test it is and what it's about, but they may want someone that has a little more information on it, enough to explain to a patient, well enough they get the idea, oh, this is a lipid test. It tests your fats, and make sure the patient, ask them, are they fasting? They'll say yes, hopefully. Or sometimes they ask what an A1C is, or hemoglobin A1C, and that tests like your average glucose for the last 3 months. So you can just tell them that. The patient does have the right to know what tests are being performed. Now it gets a little questionable when you may have an ER patient or it's a psych patient, and they ask, oh, what are they ordering on me? And they'd be like, oh, some chemistry test, It's just awkward, like, oh, they're doing a drug screen on you, But, like, they could ask their doctor, I guess. It's not really our place to always say what they're getting done, but I digress. So, and the last thing is you want to thank the patient for coming in. Obviously, they are keeping you employed by coming to your hospital, wherever you are, clinic, something like that. But without patients, obviously we wouldn't have a job. So just thank them for coming in to, you know, that specific location, and I like to wish them the good rest of their day. If we had to perform phlebotomy on them, I hope your day gets better than getting stuck by needles, or just, you know, something funny. You can kind of judge by the person, you know, how they take different things. I guess each situation's different. Now, and each person, each patient's different. I think it's important, you know, to use this Aidet protocol, but not be a robot. So you don't want to sound like, hi, my name is what? No, okay. You know, you want to make it your own. You don't want to have like a sheet that you're reading from, because that's just awkward and weird. But you know, each time you can, when you first start out, it's going to be kind of awkward, but you know, kind of getting a routine of each time going in, say, oh, you know, my name is Maura, let me put these orders in the computer for you, and then either my you know, if it myself or this person will be your phlebotomist, and they'll be drawing your blood, and we'll call you back in a few minutes. Then once you call the person back, you know, tell them what you're going to do. If they have any questions, try to answer them. And it's, like I said earlier, it's just to make the patient more comfortable in a situation where they usually have anxiety to begin with. Either anxiety because they're in a hospital, and that just makes a lot of people anxious, or anxiety because, you know, people don't like getting stabbed with needles. That's just a thing. So yeah, I hope you guys found this video informational. I think it's by Struder Group. They go and teach Aidet. I mean, maybe other groups do. I don't know if they're the one that came up with it or not, but they're the one that comes to our hospital and kind of make sure that we're following it, and kind of go over our patient satisfaction scores, which is a pretty big deal. You know, if patients aren't happy with the care they're receiving, or in a timely manner, then that looks bad on your department, whichever that department may be. So I think it's a good kind of tool to use, and you can make it your own, basically. So thank you guys for watching. If you want to check out some of my other laboratory and medical hospital videos, I will put them in here, and I will see you guys later. Bye.